All right, good evening. Tonight is Tuesday, May 31st, 2016, and you've joined a call being hosted by the National Niemann-Pick Disease Foundation, and the webinar call this evening is titled VTS 270 Cyclodextrin Clinical Trial Informational Patient Webinar. So my name is Nadine Hill. I'm the Executive Director of the National Niemann-Pick Disease Foundation, and I do welcome you all to this call, as well as our list of panelist guests who we will be introducing to you all shortly. At the moment, I did wish to indicate that I'm at our central offices moderating and hosting the webinar call for you all, and I'm joined this evening by the Foundation's Coordinator of Family Services and Marketing, Chris Clower. Chris is going to help with some troubleshooting issues should any of our attendees or panelists run into trouble during the call itself. You can call our office at 920-563-0930. So my apologies. Just checking to see how often you call into the office to see how things are going. We do plan to have a session after the presentation this evening that is open for all of our participants to be able to answer or ask questions of our panelists, and we hope to have that with a very open-ended aspect of question and answers, or you can send a question to us through the webinar screen under questions, or during the call if you have any trouble you can also raise your hand, and we'll work on trying to address any issues that come up during the call itself. I do have a quick disclaimer that I'd like to read to you that goes with regards to the information being presented this evening. The National Niemann-Pick Disease Foundation does not engage in the practice of medicine. It is not a medical authority, nor does it claim to have medical knowledge. This webinar is solely an educational service of the National Niemann-Pick Disease Foundation and is not meant to provide diagnostic or treatment advice. Information contained or suggested on this webinar does not constitute medical advice. For all information related to care, medication, or treatment, the NNPDF recommends consulting a physician to determine if information presented is applicable. So we do appreciate you taking time to listen to that disclaimer statement. And as I mentioned earlier, this webinar is being recorded, and we will be able to upload this to our foundation website so that you're all able to view the information and re-listen to it if you have any questions about the call itself, about the webinar itself. So as I mentioned, this evening we are hosting a session titled VTS 270 Cyclodextrin Clinical Trial Informational Patient Webinar. So at this time, it is indeed my pleasure to introduce to you our parent panelist moderator, who is going to be helping to oversee the meeting this evening, and that is Harry Kujayan, who is joining us from his home in the Chicago, Illinois area. So Harry, I pass the baton to you.
All right, thank you. I hope everybody can hear me. First of all, the webinar is scheduled for 60 minutes, but don't worry about that. We can stay as long as needed. As you saw, we started the webinar by showing the video about our experience with the VTS 270 trial. The agenda is each panelist will spend some time talking about their story about NPC. We will then show some data that might be of interest to you. Then we're going to open up for some questions. So everyone on this panel is a parent or someone who's being treated with VTS 270, just so that you know. If you have any questions to someone specific, please indicate so. Mention their name. If the question is for everyone in the panel, then we will all take turns answering them. Please be respectful and cordial with our questions and comments. As you know, we're all in the same fight. And for the disclaimer, as Nadine said, please note that we are providing our opinion because we're all involved with this, and and our observations. We don't practice medicine, nor claim to have any medical knowledge, although I know many of us spend hours reading, researching, and educating ourselves on NPC. So the main purpose of this webinar is to share our experience and answer any questions that you may have regarding the treatment of our kids with VTS 270. And I'm hoping that if this works out well, that we would have these webinars regularly about different topics. I know someone approached me about we should have one maybe for some of the medications that our kids take on, maybe on seizures or how to control some of the other symptoms of seizures and ataxia and cataplexy, which I think is a great idea. So I hope that we can continue on these. So with that, I will pass the baton to Mr. James Bailey. James, the floor is yours.
Hello, James. Are you able to hear us? All right, Harry, he apparently is having some audio problems, so we'll work with him on our end. And would you like to go ahead to the next speaker? We'll circle back and catch James on the back side.
Sure, and next on the starting lineup is Doug and Samantha.
Hello, everybody. I'm Doug. Harry, can you hear me okay?
I can hear you, Doug.
Okay, great. So, at least we know you can hear. I'm here with Samantha.
Hi, everyone.
Samantha has been on the drug since June of 2014. And she's been doing very well. She's been handling the drug very well, and she's been under the care of Dr. Barry Kravis. And we've seen a lot of improvement from Samantha over the last couple of years now. It's hard to believe it's been a couple of years. But she's improved in, I believe, every aspect of her life. What do you think, Samantha?
Yeah, I think that's definitely true, because now it's very clear to not only me, but also to my parents that I speak a lot more than I used to before the drug, and I am able to exercise now, and yeah.
She also attends classes, and she has her driver's license and drives herself to school and back and to a job for a while there. And she's pretty active participant in our lives, but most importantly, we've seen improvement in her social behavior, but obviously her physical and mental behavior as well. She swallows to normalcy now through the drug, and I think Samantha is enjoying her life a great deal more than what she has prior to the drug. She is more a part of our lives. She was always a part of our life, but she interacts with us a lot more than what she was for a while. And she was officially diagnosed with NPC in December of 2012. And that is, I guess, a little bit of background on Samantha and myself.
Yeah.
I would pass the baton on to, I guess, Phil. Hopefully Phil can hear me as well.
Yeah, thank you, Doug. Can people hear me, I assume?
I can hear you.
Great. I don't know. I mean, I don't know if we have James yet, so feel free to cut me off and go back to James if you'd like. Yes, my name is Phil Morella. We live in Connecticut. My wife, Andrea, and I have 4 kids. 2 of them, Dana and Andrew, were born with NPC. And, we run our own family foundation here called Dana's Angels Research Trust, named after our daughter Dana, because she was the first one that was diagnosed. Andrew was diagnosed later on. Unfortunately, we lost Dana in July of 2013, and she never had the benefit of being on the cyclodextrin. But Andrew has been on cyclodextrin since December of 2013, and he's done very well on the cyclodextrin. We did see some improvement, almost immediately, even at the lower doses. He went to the 900 milligrams in March, a little more than a year ago, March of 2015, and then a couple of months later on up to 1200. Andrew has had some seizure issues since about a month after Dana passed away, so that admittedly has been a little confounding for him. Some of the anti-seizure medicines obviously can affect a child's balance and even their swallowing, but even through that, we've seen improvement in Andrew, both in his his balance, his gait, his swallowing. Andrew even had a couple of months here where he missed his monthly treatments earlier this year because of a seizure issue and frankly having to be in rehab because he was on so many anti-seizure medicines. As soon as we got him out of the rehab hospital, we went right down to the NIH, and I have to say it was amazing to see in a matter of 3 or 4 days after that next infusion about 3 weeks ago, some improvement in Andrew. I think, as Samantha said, in terms of just his conversation and the clarity of his speaking, even his balance improved, rather quickly. So, we've been very excited to have Andrew getting the VTS 270 for more than a couple of years now, and it's really been, I think, a blessing for him and for our family.
Okay, thank you, Phil. And Rebecca, you're next.
Hello, Rebecca.
Hi, can you hear me?
Yes, we can.
Yes, ma'am.
Okay. Hi, I'm Rebecca Spencer, and my son is Jonathan Spencer. Jonathan was diagnosed when he was almost 4 years old in 2009, and he has been on cyclodextrin since March of 2014. He is on 1,200 milligrams. He started off at 900. Jonathan had a few neurological, but not a lot of symptoms. He had a little swallowing issue, also some problems with his walking. He started to walk inward, which has resolved. He's walking more correctly now, and he has 0 swallowing issues. We believe cyclodextrin has helped him out in so many ways, quality of life, and he's just a happy little boy that runs around, and we try to make it as fun as possible and know that we have hope.
Thank you, Rebecca. James, can you hear us?
Yeah, I can hear you. Can you hear me?
Yes, I can, James. You got the floor.
Great. I'm James Bailey. I'm the father of Caden Bailey. He's 10 years old, and he was diagnosed with Niemann-Pick disease when he was 6 years old. We had a heck of a time trying to find out a reason why he had an enlarged spleen, which we found that out when he was 18 months. And we happened upon a neurologist in Houston at Texas Children's, Dr. Zeller, that eventually put us onto the test for the Niemann-Pick disease. And we got confirmation through the Mayo Clinic with Dr. Mark Patterson and his group up there in January 2012. Kate has been participating in the trial study since December of 2015. He's had 12 treatments as of so far, and of course we're on the blind end of the study, so we don't know if he's receiving the medication or if he's actually receiving the sham part of it. As far as being able to tell the difference, personally, I mean, we can see some things he improves on, but other things he declines in. So it's kind of hard for us to say as to, him being able to make any big difference as in our eyes. But I mean, again, like they said before, we're not, you know, in the medical part of this. We're just the parents, you know, trying to see if there's any positive side to this thing. The Dr. Kravis and her group in Chicago, you know, we go up there and we do test evaluations every 4 visits, and that, you know, in itself, you know, it shows us some improvements in some areas, and in some areas it doesn't seem like he's improving. But I mean, we can't really tell the difference. He's not mobile as far as being able to walk on his own. He does have to have assistance. He's active, and he plays with his brother quite a bit as far as wrestling on the ground and things like that. So I mean, he's very active. But you know, the results of the study is to me is yet to be seen. But you know, it's the one thing that we have for sure that can reach out there and help these kids that need the help so desperately bad. Harry? Can you hear me?
Yes, I can.
Hello? Okay.
Hello, Jane? Okay, yeah, I can hear you. All right, our story is very similar to many of you. Your typical decline in school, and it took us a while to finally diagnose Haley with Niemann-Pick type C, and we connected with some of the families in during the Baltimore NNPDF conference, and then our Dr. Kravis was more than gracious to accept our request to treat Haley with cyclodextrin, and she went through the FDA process with help of other families, and our first treatment was on December 23rd, 2013, and I think we just had our 64th treatment. I mean, we decided to do cyclo for many reasons. I mean, Haley was declining, as you're going to see some of the other numbers before. So we knew what the outcome was going to be, and also by looking at other families, we knew that cyclo was safe. Other families are treating their kids with it. It was tested in mice and cats, so we knew it was safe, except obviously the hearing, which is part of the NPC symptoms anyway. We've seen many improvements, you know, from swallowing to memory. You know, we have more good days than bad days these days, so which is great. In a way, we're lucky that we live in the Chicago area. Our doctor lives about a couple miles away from us, so we pick her up on treatment day and we drive there. If there are no additional tests, then it usually takes us about 2.5 hours. The procedure itself, from start to end, is about 20 minutes, so it's not a long procedure. But then Haley has to be in a Trendelenburg position for about 40 minutes, and since Dr. Kravis right now treats about 17 NPC kids, there's always some NPC family in the visitors area, so we just hang around and talk to other families. So that's our story. And then if we can move the PowerPoint forward. What I want to do is, if I can, show you some numbers. Some of this is from NIH. I requested if I can show these numbers, and they were gracious enough to say yes. And then the next few slides are from Samantha's and Haley's data, so I thought that you might be interested in this. So basically, this is the domains that NIH monitors. These are the progression, or these are the symptoms that you see progression in for kids who have NPC, like swallowing and memory and speech. And what you can see here is that this is after 12 months of data from phase 1 trial, which some of you in this call are part of. And what you can see is that anything that's 100 means that the disease has stabilized. Anything above 100 shows that there was some improvements that were noted, such as the cognition and swallowing. You can see that on the decline side, there is some eye movements that were declined, and then hearing, as we know, because of cyclodextrin. But if you take out the hearing issues, which are still an issue, but if you just take that out, then you can see that the disease has stabilized on all the patients that are currently in the clinical trial. Now, just to give an idea of what these are, these domains, you hear about the NPC rating scale or the NPC score, and basically what it is that there are 9 different domains, and every domain, some of them you see here are rated from 0 to 5. 0 meaning no issues, and 5 meaning many issues. So, for example, swallowing example would be if you have no swallowing issues, you'll be 0. If you're 100% dependent on feeding tube, then it will be 5. And this is how how the doctors monitor the progression of Niemann-Pick. So just to let you know that what those domains are. So Nadine, if you can please go to the next one.
One moment, Harry. Well, Vance,
No problem.
Just a moment.
No problem. I can try to do an abracadabra from here.
We might have to. One moment, please.
All right. Maybe down arrow might work. Okay. Or maybe if you can come out of the presentation mode, then we can just, there we go. All right,
my apologies. There you are. Sorry.
All right. No problem. So this is the NPC rating scale. If I can just talk about it, I mean, this is what we all monitor because we want to see the progression. Again, this is the next 3 slides is just some information from the 3 of the patients that Dr. Kravis treats under an IND. She treats 6 under IND and 11 under the trial right now. And I just want to make sure everybody knows that, keep in mind that this is data for these 3 subjects. It doesn't mean that it's going to be the same for all kids. In some cases it might be much better, in some cases it might not be, but again, these are just for the 3 that's presented here on the data. So if you can see for subject 1, 2 years before we started the cycle treatment, her NPC score, rating scale was 20. 12 months before we started cyclodextrin, it was 22.
I can't hear you. What?
When we started cyclodextrin, it was 31. And then once we started with cyclodextrin, we started the NPC rating scale started to decline, which is great, and it has been stable since then. For subject 2, it's been it started at 2 and it's still at 2, and for subject 3, it started at 10 at baseline, and 6 months later it's at 6 or 7. So this is some of the trend that we see at least on these 3 patients that Dr. Kravis treats. So if you can please move to the next one. All right, this is the final slide I have. What this is it's a test called NeuroCom, and basically what NeuroCom does, it measures the response of the brain to changes in the environment. So it comprises of 6 different tests. What the blue bar that you see all the way at the end is the normal response, and then every bar that you see from left to right is a test that we do, and we do it every 2 months. And the reason they do it every 2 months is because there's no learning effect by doing them often. In the middle, you see some of the dosage that these kids were on. And what you will see is that for subject 2, the first 4 tests were in the normal range, but you can see that in tests 5 and 6 they were low. But as you can see is that as this kid was being treated with cyclodextrin, that the numbers started to go up in tests 5 and 6, and it's now in the normal range. If you look at all the way to the right side of the composite. And similar numbers for subject number 3. Test 1 or 2 were, you see, normal. In test 3 and 4 and 5 and 6, you can see they're way below normal. But as you can see, once they started to get treated with, cyclodextrin or Vitesse 270, then they're either back to normal now or they are moving towards the right direction. So that's all the information I had. So I thought that you might be interested in some of the data that we have, and we would like to share our data with anybody who would like. There's, and if there are any doctors that want to look at our data, we'd be more than happy to provide that. So with that, I'm going to pass it on to Nadine, and Nadine, you can open the question. And again, please, if you have a question for somebody specific, if you can just ask for that question, that specific person. Otherwise, if it's a panel, then we will open up the question to the panelists. Thank you.
Thank you very much, and thank you again to all of our panelists, and a special thanks as well to Samantha for joining us. I know you're busy in college, and hopefully your exams are over, so we appreciate you joining us. I do have 2 questions that came from people on the call this evening, so I'll read those out, Harry, and then if you can't answer them, perhaps someone on the panel can jump in and address the question. So this question comes from Karen Quant, and Karen's question first is, she has a 2-part question. Can the panelists speak directly about any hearing issues their children have had? And also, after that question, she would like to know how many patients total are enrolled in the Vitesse trial. So Harry, I guess I'll kick it back to you to start to first address the issue that on hearing, and then any other speakers that would like to join or address that call as well, or that question.
Sure, I can talk about Haley. Haley started with having hearing issues even before starting cyclodextrin, because again, one of the symptoms of Niemann-Pick type C is hearing loss. So at the beginning, when we were starting with this procedure, we used to do a hearing test before every procedure. So every 2 weeks we used to do a hearing test, and depending on the day, if she felt good or not, her numbers would be either not good, or next week she'll be good. But if you plot it across all the time, and by the way, right now we do it every 3 months, 3 or 6 months, because the decline or the hearing has been stable. So from what we see is that we haven't seen that much decline in Haley's hearing. However, we still decided that to increase the quality of life for her, actually next week we're going to go to talk to an audiologist to fit her with hearing aids. And we think it's, why not? It's going to help her, and why shouldn't we? As far as the Vitesse trial, I know that Part B, the first part of Part B is complete. So there are 12 patients that are enrolled. And as far as numbers on, I think there are additional kids who are being treated right now as the second part. I don't know what the terminologies are of second part of the trial. But as far as numbers, I do not know how many are actually enrolled in the second part of the trial. I know it's at least 12, but I'm not sure what the total is right now.
What we could say about that, Harry, as well, is we do have the Vitesse press release that just came out talking about moving on to the second portion, or the Part B of their protocol. So that is the latest public information we have available for our patients as well with regards to the Vitesse trial and recruiting.
If anybody else wants to talk a little bit more about
the hearing. I can say something about Samantha's hearing. when she was first tested, she actually already had declined a little bit with her hearing. And when we brought her into the use of VTS 270, and she's also on an IIMD, she's not part of the trial, she did have some hearing loss, especially the higher frequencies, but it also would recover, and it seemed to, like Carrie, stable off. It hasn't really gone any worse than what it had done in the first few treatments. And Samantha's currently on 300, so she's pretty stable both for her hearing as well as her dosage. So we haven't seen any additional decline. Again, we haven't had any increase in dosage. But we put Samantha on hearing aids about 4 months ago. She started wearing them, and with the hearing aids, she's become even more talkative beyond the drug, so that's nice. She wears them wherever she goes out, and the only time she doesn't have them is probably when she sits down and watches TV in her own room. But the hearing aids are definitely a plus, and I think that's something I would recommend to anybody that is on the VTS 270, but even if your child is not, I mean, I think if they have a hearing issue, they should get the hearing aids, because we've seen improvements with the hearing aids as far as Samantha's communication skills. Because her speech clarity is improved when she puts them in without any question.
Yeah, this is Phil. I think I'd like to echo what both of you said, and just sort of indicate that Andrew is going to be 17 on Friday. What they never said to us at the NIH, Andrew was actually the second child to participate in the natural history study going back to 2006. And what we learned as we entered into the phase 1 for VTS 270 was that Andrew already really had enough of a high frequency loss that he would benefit from hearing aids, and in essence they had just never really said that to us. As he didn't really have any hearing loss whatsoever, as his dose went up at 900, he had a little bit of a hearing loss. It was actually sort of a borderline grade 1, grade 2. A few months later we went up to the 1200, and he had a little more hearing loss. But as you said, it was really the kind of thing where a higher dose seems to create a little bit of an impact. Then there is some recovery, and then continuing at that dose doesn't seem to make anything worse. We've gone back down to the 900 milligrams now because that's the expectation going forward. That was announced as the dosing for the phase 2-3 trial. And actually this past month when Andrew went, his hearing had improved somewhat over those couple of months that he had missed. And he has hearing aids. We got them about a month after we went to the 900, and it really was a shame that we hadn't gotten them earlier, just from the progression of the MPC, the high frequency loss that he had. While it wasn't particularly noticeable to him, the issue really was the clarity of his speaking, the ability to make a distinction between certain sounds that are very similar phonetically, I guess. And so, the VTS 270 has really had no impact on his quality of life whatsoever with the hearing aids and the sophistication of them these days. When he's wearing them, his hearing is effectively perfect. They literally are able to adjust for the different ranges that he is lacking and to leave those where he isn't alone. So the hearing aids have actually been a blessing, and I think if we hadn't experienced this with the VTS 270, we'd probably still be having him get by with less than quality hearing.
And if I could say something too, this is Rebecca Spencer. With Jonathan, we also found out before we started the treatment that he had a little bit of the high frequency hearing loss, and when he got to 1200, he did have a grade 3 change in his hearing. He also got on hearing aids, and it has been amazing. I mean, he loves his hearing aids. If he goes an hour with missing his hearing aids, he freaks out. He loves them so much. So he definitely feels a difference with them. And his hearing has gotten a little worse since he started the every 2 weeks because he was going every month. Now he's every 2 weeks. And again, it's in the high frequency range, so he's still at a grade 3 loss. But with the hearing aids, it's not noticeable at all. And when he doesn't have his hearing aids, it's more of the phonetics of the sh and the sounds and whatnot. So it's a blessing with the hearing aids, and honestly, there's no difference in quality of life since he started the VTS 270.
Okay, do any other of our panelists have responses to the attendees about hearing? Would you like to jump in right now? I think maybe James Bailey might be the only individual we didn't hear from on that topic.
A little bit of high frequency loss, but not to the significance of the other kids that have reported in with their parents on their hearing. Then again, you know, we've only received 12 treatments so far as compared to a lot of the other kids, and you know, they haven't noted to us that, you know, that there was a big significant loss in his hearing. It's the amount that they're showing that Caden has lost on his high frequency hearing is very minute compared to a lot of the other kids so far.
All right, thank you very much. Thank you to all our panelists. I think that was well covered. We did have some individuals jump online and pass along happy birthday greetings to Andrew Morella. So Dad, you need to send those greetings along to your son, please. And I will,
thank you.
Okay. I do have a question from Margaret Mackerel, and she's in contact with us from Sick Kids Hospital in Toronto, Canada. And her question this evening is, are children who have been diagnosed in infancy responding to VTS 270 or cyclodextrin? Is there anyone on the panel that might be able to respond to that in the dealings that you've had?
I have not.
I'm not sure how infant. I know that there are a couple of kids that are started on. There's one kid that I believe that started on SlideFlow when they were 2 or 2.5. I know another kid also started cyclodextrin before the age of 2. But again, I'm not sure. I don't know what the details are on that.
Okay, thank you. And again, Margaret, that more likely is because the age limit is limited with regards to the clinical trial itself. And we may be able to get more information. There's going to be presentations at the Parsegian conference, and there may be opportunities to learn more information there. I would like to note just briefly, again, to our attendees, if you have any questions, you are able to post your question on your computer to us, and I can then read the question aloud to our panelists. And also, the other option is in a few moments, if we get to the end of all our questions and we still have time, I will attempt to open all of your mics so you can ask questions one at a time, and we'll see how that goes. But so at this point, if you do have a question you want to have addressed by the panelists, please enter it into the question segment and I can direct it to our panelists. Our next question comes from Michaela, and the question is to our panelists: does anyone on the panel know anything about possible discussions about moving forward with a reservoir to administer cyclodextrin or VTS 270?
This is you. Okay, go ahead.
I'm not aware of any reservoir being done at this time.
This is Phil. Was there something in the press release about that? About when they went to disclose the 900?
I believe that was the press release for Europe. If I can recall. Harry, do you remember that press release where they were looking to bring it through final phase in Europe with the pump?
Yeah, I don't know all the details. This is Harry, but I know that Vitesse is actively looking into introducing some kind of a device for the treatment for a cycle. I think if I remember my details right, again, this is just and this might not be true, but from what I remember is that it's easier. There's all the devices approved in EU, in European Union, for other treatments. It might be easier for approval in the EU, and I'm sure that U.S. still is in the horizon to come out with some kind of a device for instead of the LP, then to introduce cyclodextrin or Vitesse 270 through the device. But I think there was some discussions in the announcement about that.
All right. When at the end of the meeting, I will send along that press release to everyone.
Yeah, actually, Nadine, if you look at the press release, it stated the test has formally begun working on getting a device that will eliminate the need for lumbar punctures. The goal is to introduce this device during Part C of the trial in Europe. The device is already approved by the EMA, and to get the device approved by FDA and have it introduced in the United States as well. That was part of the press release by the test.
Great. Thank you for pulling that up and getting that
Actually,
information.
Chris pulled that out for me.
Okay. Thank you. All right. We do have a question from Mandy Whitechurch. And Mandy's question is, she is wondering if any of the families have had to stop any natural remedies they were using prior to the administration of VTS 270. And if they have noticed any decline in what they may have been seeing improvement on with any of these remedies. Also, please indicate what those remedies are.
This is Phil. Andrew had been on, just about everything that we've thought might have some natural benefit. Including the N-acetylcysteine, the NAC, which we had done a bit of a clinical trial with. He was probably, I'd say, he was on the curcumin. He was taking extra vitamin D, I want to say. I don't know. There were 4 or 5 things that we were supplementing with Andrew. With just the Zavesca. In becoming a part of the VTS 270 phase 1 trial at the NIH, Andrew had to get off of all of those other than the Zavesca, and we clearly didn't see any loss from giving those up. The VTS 270 just seemed to take over. My own mind, just knowing what we've seen with some of the animal studies, this may even make Zavesca unnecessary, which would be wonderful for those of us in the United States who either are frustrated that they can't get it because of the cost, or worry once or twice a year that their insurance company is going to decline it. So we haven't even thought a second about the fact that, for example, he's not taking the NAC or this curcumin.
Are there any other responses?
Yeah, this is Harry. We did not, since we were going through the IND route, we did not have any kind of restrictions. But again, we didn't. We tried some of the other that Phil mentioned, but right now for Haley, she just takes her Zavesca, her just their regular vitamins. We also give her salt tablets because one of the medications that she takes depletes salt, which can cause low amounts of salt can cause seizures. So she takes salt tablets. She doesn't like it, but you know, she's a trooper. But besides that, we really don't have anything else. But as I was saying earlier, you know, if there is another session that maybe we can do that people can talk about some of the other medications and natural herbs that people use that have seen positive results, that'll be great.
And thank you, Harry. That's a very good reminder. The foundation does hope to incorporate more of these types of webinars throughout the year, as not only as issues come up with regards to clinical trials, but to start to address areas where families may have more routine questions with regards to the progression of the disease that will we can have families just like this panel this evening who have experience with certain aspects of the disease, and then likewise can give their background and levels of experience to our other families. So I do have some more questions for you all. Again, remind you, if you have questions, please send them via the email question, or the email, or send them via the questions via email. This is again from Mandy Whitechurch. She wants to know if any of the children suffer any tremors, which in turn cause issues with administering of VTS 270 via the lumbar puncture.
Go ahead, Phil.
Caden hasn't shown any tremors or anything of that nature through any of his treatments. In fact, he's done rather well on his treatments. He's taken it pretty good as far as coming out of it and going through the procedure itself. And he's ready to go like 30 minutes after he gets up. He's ready to charge out there and see what's next.
This is Phil. You know, Andrew with his seizures, he does the procedure just bedside with a little bit of Ativan, just a little pill to, so let's say, take the edge off. After he did have a seizure once during the procedure, which was really not a complication at all, but just made everybody a little nervous going forward. Since then, they've given him a little more Ativan just to make sure that he wouldn't have a little breakthrough seizure while they were giving him the lumbar puncture. But it hasn't been an issue at all. It's as you probably heard, it's really such a relatively short procedure that it goes very quickly, and they haven't had any problems.
So Samantha doesn't take anything prior to the procedure. She's never had any tremor after the procedure either. So it hasn't affected her at all as far as the tremor goes. She's had a slight tremor before, but that tremor when she drinks has actually declined since the use of VTS 270.
This is Harry. Same with Haley. We give her a melatonin before the procedure, and she sleeps throughout the whole process. The first or two procedures that we did, she had some headache issues and some vomiting actually. But then a family from Oregon told us about a needle that they use with the Whitaker needle, and we've been using since then, and we have not had any issues.
Okay, great. I think we had a pretty well-rounded discussion on that. So thank you again, Mandy, for that question. She has one last question for the panel, and her question is with regards to the assessments. So included in the assessments are blood works carried out, and are any iron deficiency coming up, or are they showing improvements?
This is Phil. I haven't heard any discussion about the iron. I'm not sure if in particular it's even one of the endpoints that they're looking at. Niemann-Pick children have a very unique form of anemia, as my understanding. I guess the one supplement that Andrew does take, notwithstanding the trial, is iron, which is a conversation we have to have periodically with his local pediatrician, because she doesn't know why he's taking iron. His iron level in his blood seems fine, but apparently with the more detailed tests that they've done as a part of the natural history study, the children's iron collects differently than it would in a normal person, or at least it might, maybe not in all cases, but in Andrew's case, either the collection of the iron is in larger collections or smaller globules in the blood than normal. And so Andrew takes an iron supplement every day. So it's a rather unique form of anemia, and I don't think that they're worried about it particularly, and I think that those types of measurements don't satisfy the FDA anyway, so that's why there's probably not a big focus on it.
Hi, this is Gail. Haley's iron levels just dropped a bit, just below the normal level, and she's on an iron pill every other day, and it's brought her back up to normal. And this is just within the last 6 months to a year. But I also, I'm not sure if it's because of NPC. I believe it's due to heavy periods. So I'm not, I'm not sure if it's, if it is because of the NPC. But she is taking the iron pill every other day.
I would say Samantha is actually also on an iron supplement, and she had also some heavy periods, but she's on the supplement and seems to be fine.
Yeah, I only have but I only have my heavy day would be like my second day.
Okay, great. Any other questions then on the iron, or have we exhausted that with our panelists? Okay, I don't have any other questions that have been submitted via email, so I did want to just indicate a few things before I open the mics for the attendees, in case there's someone who was having trouble sending their questions, that they could ask questions of the panelists directly. The first thing is, we will follow up this call with an email update to all of our attendees, as I mentioned, with information discussed during this evening's call, but that we want to make available to you. Likewise, should you come up with a question after the session is over that you would like to have addressed to our panel, please send that along to us as well at the NNPDF central offices. We'll send that to our family of panelists and ask for a response, and then we'll share that as well with the entire group of attendees, so we can keep the discussion going, so that anyone that has questions certainly can get those all addressed. So any questions after this is over, please send to our general email address, and that is nnpdf@nnpdf.org. And that is Nancy, Peter David Frank, or National Niemann-Pick Disease Foundation. So at this time, I would like to, again, before we go into open mic and total mayhem, thank all of our panelists who have joined us this evening. We certainly appreciate you taking time out of your busy schedules. And again, Samantha, for joining us as well and sharing her experiences on being a recipient of the VTS 270. So at this time, I'll open the call to questions. I have unmute. All right, so I'm unmuting all of the attendees, so if you have questions, you can holler out. Do we have anyone with questions?
Hi Nadine, it's Mandy.
Hi, Mandy.
How are you? Just like to ask Hayley how she finds having the lumbar herself. Like, does she find that it causes her pain? Or I'd just like to hear from her what she thinks of the procedure itself.
I believe, Mandy, you mean Samantha, right?
Yes,
Samantha
I do, sorry.
Yes.
Okay.
Right, Samantha.
So Samantha stepped out for a second. So Samantha, she asked you a question. The question was, how do you feel? Well, can you ask the question again?
The question was how she copes with the actual procedure. Does she feel pain?
No, not really. I just feel slight pressure when I'm getting a procedure. There's like pressure in my back. But it doesn't really hurt.
Okay. Do you find it hard to sit still, to lie so still?
No, I'm fine with sitting still. Because I like to actually listen to music when I'm getting the procedure done. So that usually keeps me pretty occupied.
That's great, thank you.
All right, so you understand we do pick up a lot of background noise when everyone is off mute. So if you don't have a particular question that you want to present, you can put yourself on mute. But are there any other questions at this time for our panelists? All right, then Harry, I think we can, I will give it over to you to give thanks for the evening and help us have the final word.
Oh, thanks, Nadine. Yeah, again, you know, we are more than happy to answer any questions. I don't claim, or we don't claim to know all the answers, but we may be able to get some answers. And again, I'm hoping that we would do this more on a regular basis because we need, you know, there's so much information that we can all share. I know that sometimes on Facebook, for example, somebody will post a question like what treatment or how do you treat this, how do you treat that, and everybody jumps in and it's so helpful. It's so time consuming, but conversations can go much. I think we really, really need that. So I'm hoping that we would do this at more regular intervals, just different topics, and if you're interested you can join, and I'm sure it will be recorded so you can listen to it at any time you want. And now Haley has to say something. Haley, what are you going to say?
Hi!
That's from Haley saying hi.
Okay.
And now she's saying bye-bye.
All right. Well, that's a perfect way to end the evening. And so we'll say goodbye to everyone else, and we hope to hear from you all soon. Thank you very much.
Thank you.